Hello, everybody, and welcome to this exciting webinar on the fertility tech industry. My name is Richard Norman. I am Managing Director on the senior team here at Crowd, and it's my pleasure this evening to have a wonderful group of panelists that are joining us tonight on the webinar to discuss this space. I'm joined first by Claire Tomkins, CEO of Future Family. Hi, Claire, how are you?
Hi, Richard. I'm well. Great to be here.
Great to have you. Thank you for joining us. And our crowd just closed on its first investment into Future Family. We are continuing to invest and support this important company. And it's a space and a company that we spent a considerable amount of time in, and a space that's getting a ton of attention over the last couple of years for a lot of reasons that we'll be discussing here this evening. We are very, very excited to be in this company. And without further ado, I think we'll dive in and hear from Claire a little bit about what the company actually does, and then set that in the context of what's happening in the broader industry and why we think that it's such an exciting space and why there's going to be so much for us to do here. So Claire, again, thank you for joining us, and perhaps you can share with us a little bit of what Future Family is and why it should be on our radar.
Yeah, with pleasure, and thanks for having me. I'm joining everybody here from a somewhat rainy San Francisco, California. I spent a lot of my career here in Silicon Valley, and what led to the founding of Future Family was actually a personal experience of going through fertility treatment to conceive my 3 children. So I have three kids. My oldest daughter is now 6, which seems incredible, and all 3 of my kids were born with IVF. And for those who are just joining us to learn more about fertility, IVF, in vitro fertilization, is this growing trend that's helping a lot of women and couples start their families. Going through that experience personally and being here in the Valley, working on a lot of tech projects, it was eye-opening to see how little tech was being leveraged in the fertility space. It's a growing space with a ton of medical advancement, but it is also a space that today is serving a very small percentage of the population relative to who needs access to care. So what I learned going through this personally was that there's a huge access gap, and we'll share some stats and facts, and we're going to be joined later by a few special guests to talk about this more. And so Future Family is building into this market around 2 dimensions. We are both a FinTech and a digital health platform. And the thesis behind the company is really to help more women and couples access care and start their families. We'll get into some of the numbers around this, but just at a personal level, a single round of IVF for a couple today in the US might cost something around $22,000 to go through IVF. It's sometimes an unexpected expense. It's an elective healthcare expense. It's not covered by insurance. So one of the first things we built at Future Family were flexible, easy financial plans to help women and couples easily go forward with treatment. We package IVF through our clinic partners into plans that usually start anywhere between $350 to $450 a month. And then the second innovation on the platform was around wraparound services for fertility patients. So we're offering support, including fertility coaching, and I'm happy to share what that means. It's a little bit of a buzzword to all of our clients as they go through this experience.
And Claire, that's helpful, but if, that's clearly an expensive number for a lot of these clients of yours. If they weren't turning to the Future Family solution, what are the ways that people today are actually financing that large expense?
Yeah, and so I think what you are seeing in FinTech today as a general trend is a move towards what we talk about as buy now, pay later. It's a huge trend eating up a lot of FinTech, whether you look at retail with the Affirm IPO, durables with things like Peloton and how they're doing their pricing, or ultimately healthcare services with elective orthodontia, et cetera. It's very much moved into a buy now, pay later model. Now, that model does not exist today for fertility, and that's part of our pioneering contribution here. What you see is a highly fragmented market where people struggle to figure out what's the right way to pay for fertility care. Some people might turn to just very traditional but outdated solutions like high interest rate credit cards, and people borrow money if they can from family members. But the vast majority of people we talk to either delay treatment or feel that they are kind of priced out of this market, at least initially. So there are not good solutions today. we have seen in what I would think of as Gen 1 of FinTech, a lot of horizontal players, people who will offer you a digital personal loan. But those loans are not in any way customized for the fertility patient. So they don't come with any support services, which is something we've built out on the platform. But I think perhaps more importantly, they also don't come with any financial support around how much money you need to borrow for fertility, who needs to get paid. And there's a whole back end to actually going through fertility treatment that Future Family is addressing.
Amazing. I think let's jump in and hear a little bit about what's happening in the market and set that in context of where the company is in this position today.
Yeah, we had prepared to share a few facts and stats with the audience on what is driving this market. For those of you joining today, I suppose I would be surprised given the numbers if you don't personally know someone who's been through IVF or who's maybe even currently going through it. So today, the CDC, our governing health body in the US, estimates that 1 in 8 couples have faced some fertility challenges. It's probably worth mentioning that it is not just challenges that impact women, like men have also fertility challenges. And today it may be as many as 1 in 8 couples. We project in the future is going to be 1 in 5 couples. And we'll talk about why that's the case. But we're talking about a massive healthcare trend that could affect up to 20% of the population. We're going to later be joined by Dr. Angie Beltsos, and I'll do her introduction. And she has shared with us that some of the projections from the industry are that over the next century, 300 million babies will be born using IVF. And when we look at some of the advanced countries adopting IVF, Israel is actually now, I think, between 4 and 5% of live births. So, close to, a very large percent. And then Denmark today is already 10% of kindergartners entering, kindergarten in Denmark are born with IVF. So this is a huge trend that is global in nature and kind of sweeping across a lot of different markets.
And today, just to be sure, today in the US, Claire, so how many babies are being born today in every 10 in the US via IVF?
Yeah, we talk about this as the access gap. So today in the US, 2% of babies are born with IVF. So obviously significantly different in terms of 2% in the US, 4 to 5% in Israel, 10% in Denmark. You can see where these trends are going, and we'll talk about why that is. And of course, we believe a big part of this is about access to care in the US and potentially other markets as well. So this was much of life, it's timing, it turns out. And this was a moment of timing where I remember vividly sitting around the table, my husband, cup of coffee, a croissant, and talking about in 2016, the CDC dropped a huge report. And they said that for the first time in human history, more women gave birth in their 30s than their 20s. It's a very hard trend to overstate. It was a shift. It was a Gladwellian tipping point that so many more women, myself included, were choosing to give birth in their 30s, and it had to do with career and finances and finding the right partner and balancing a lot of aspects of modern life. There's a lot of advantages to starting your family a little later, but unfortunately, biology is not on your side. And so this is one of the major trends that is now driving this global shift, that we are starting families later in life, and that is across many countries in the world, and that we are not only starting families later in life, but we're exploring fertility preservation as a way to support those choices.
And I guess what's helpful maybe is that as that demographic is having babies later in life, they are also probably in a financially better place to be making decisions on fertility treatment and supporting financial plans to have fertility treatment. And so the quality of client that you're getting is incrementally stronger, just because I think the earning potential, we would all agree, of someone in their 30s, it might be stronger than someone in their 20s. That just probably opens more options and opportunities for them.
Yeah, I think if you look at it from the perspective of a FinTech company, we are certainly reaching and helping women and couples at a moment where it's a great fit for our products and our solutions. We often talk about this as being, in finance terms, we're helping a lot of couples in a responsible phase of life absolutely well positioned to take out and then pay back a fertility plan. But if you find out, at 32 or 35 years of age at the doctor's office that you're going to need fertility treatment, and then you're told in that same breath that this might be a $22,000 expense that could actually go to $60,000 depending on how many rounds of IVF you need to conceive, that's also still a huge financial pain point when you might have either been saving for or purchasing a home and have other financial commitments. So that's where the Future Family Financial Solution comes in. And we really view ourselves as a partner to the consumer. We're not only helping with the financial dimension, which is really critical here, but we're also, of course, providing a lot of support services along the way. And we're going to hear about those a little bit later with a surprise guest at the end of the show. So talking about, the big picture globally. So I think that the tailwinds here, starting families later in life, that is a huge dimension of the rising demand. It's why we're at 10% of new babies in Denmark, and why we're going to go there in Israel and the US and Latin America and other countries. So there are some underlying trends in addition, but we have residual biological infertility across populations, and that's something that's not been well addressed in the past. I certainly personally know dear friends of my parents who were perhaps never able to start a family because we didn't have this set of solutions before. Obviously, we've talked about the age trend, the LGBTQI community, who are starting to, more families than ever. We've been really excited to support a lot of those families at Future Family and on our platform. Genetic screening is something that obviously is compatible with IVF, and we'll let Dr. Belta share some more insights there, but just the ability of this technology to ensure that you could have a genetically healthy child, which is so important to families and those of us who might know that we are carrying a trait or something we are concerned about. And then last, but certainly not least, fertility preservation with egg freezing. There's going to be so many wild stories about the COVID chapter, the 12 months of COVID. One of the fertility stories around COVID is that egg freezing exploded. The CAGRs on egg freezing were 40, 50% in 2020. And what really happened was the dating market kind of slowed down, and more people found themselves at home, possibly in athleisure wear, and egg freezing just took off in a way that we hadn't seen before. So this is a growing market where, with education, with media, women are, of course, realizing what I learned firsthand when I tried to conceive. Now women are better educated that fertility preservation for both eggs, embryos, and even sperm can be really important if you are planning to start that family a little bit later.
And Claire, if I can ask, how do these each play, or not each of them, but in general, how do you think about this as revenue opportunities? When you're building a company and you see many interesting ways to play it, many different forces that are driving the growth, how do you actually tap into each of those as a revenue opportunity?
Yeah, well, so I think the fertility preservation market, for instance, has been considered kind of a nascent market and has not even been factored into the TAMs that we've been talking about today, where the global market today is about a $37 billion global market, and which we cover here. That's today's market globally. If you look at the people who are not getting access today, that's about a $150 billion market. And so that delta is people getting services today versus people who really want services. There's a lot of pent up demand here that is not getting access.
And that lack of access is largely an affordability issue.
Yeah, it is both dimensions. It is affordability as well as complexity of the self-managed healthcare journey. So it is a fairly daunting experience to go through fertility treatment. And so we see patients and couples dropping out for psycho-emotional reasons, where it's just a lot to take on. And especially if you've been through one round of IVF and hasn't succeeded, or you've perhaps experienced loss or miscarriage along the way. So the dimension of care that we've been really investing in is that certainly it's about opening up financial access. It is also about providing patient support and patient care. So all of our patients are paired with a built-in digital coach, a fertility coach who is a registered nurse, clinically trained in fertility, and he's there to help support and guide your journey. And it's making a huge difference to patients. And we believe that with this package solution designed for the fertility patient with on-demand digital support, think of it as concierge fertility care, paired with a financial solution is what can help many more couples access care and ultimately realize the dream of, starting or expanding their family. So I'd say it's both.
Great.
So with that said, obviously Future Family is not the first to figure out that fertility is a huge and expanding global market, and we're very excited to have with us today a special guest. So Dr. Angie Beltzos is the CEO and the Chief Medical Officer at Bios Fertility. Bios has HQ in Chicago, and Angie has been a pioneer in this space, and actually in founding Bios has now expanded locations to multiple states, serving more and more patients in the Midwest. So talk about someone who's actually creating access to care. And we invited Angie here to share a little bit as a leading medical officer and as a leading reproductive endocrinologist, what is going on the science and the advanced side of fertility. What are we seeing that's helping more patients? And to really get Angie's perspective, and I will add that Bios is and remains a really trusted partner to Future Family. We have a network across the US of fertility clinics where we work together to support patients and offer financial and coaching solutions, and Bios is one of those clinics. So Angie, welcome to our webinar on the future of fertility. I can't think of anybody better to talk about the future.
You are so lovely. Thank you so much for having me here today. Very excited to talk about this topic with everyone.
Great. Well, let's dive in. And one of the areas we wanted to touch on, Angie, is the medical advancement, the things that are shaping how we drive success and outcomes for patients.
Well, this is such an important topic, and I think there are three transformative elements to the topic we're talking about today. The first one is medical advancement. I think the second item that we'll cover will be this shift in the patient's perspective, and finally, access to care. And when we talk about medical advancements, we look at some of the technologies that have been really transformative to our industry of reproductive endocrinology. And I think one of them we could start with is vitrification. And what that means is that we are actually freezing cells in such a rapid way that the ability of a little embryo to survive being frozen is amazing. It's 95, 98% or greater, and they just sort of perk right up and hit the ground running. This allows for not only incredible success rates today and later in years to come to use these eggs, embryos, or even sperm for future children. The cryorepository where we keep these precious cells, where we keep them safe, is also another area with things like the Tomorrow tank and the cryo robot. And the other element is egg health. You're working so hard to really bang the drum of that women's age is critically important to our ability to have a child. And so really taking charge of fertility is something we're trying to educate women all over the world. Yeah. So egg health is something else that we've been studying. AMH is a hormone that can help us understand how many eggs are left. So that's become a very sexy test of a woman's future fertility, if you will, and really measures quantity. But I think, these advancements also include, once we remove the egg, we have artificial intelligence, such as technology like the Violet camera, that can grade the egg and tell us how likely that egg is to make a healthy embryo. So I think these are just the tip of the iceberg on things that are coming and are here.
So exciting.
And in terms of bringing more people into the market, right, I think it's such an important point that the better and more precise our medicine gets and our treatments get and our success rates get, more people between the $37 billion and $150 billion of demand will start to move from sort of latent demand into actual and realized demand, right? Because they'll see that it isn't going to take me 3 cycles and maybe I will, maybe won't, but I have a much greater shot of, one and done and actually walking away with the baby that I want. And that is, because I think there's this fear factor for people, right? Is like, I'm going to go through this process and I have absolutely no idea of like, is this going to work for me? And the better the science gets, the more people will take that step and say, no, I want to do that, which ultimately means, more clients for companies like Future Family to help get started in building their families.
It is exactly that. The number of people that access this care, and we're gonna, I think, come to that with our third point, is tremendous. So I think we will be able to have so many more people have a family either today or waiting for their future. So
Yeah,
I think
that's such a hopeful message. That's such a hopeful message for seeing where this industry can go, because I think in a perfect world we'd be able to help anyone who wants to navigate this journey to becoming a parent do so. So that's a good segue into Dr. Belta's talking a little bit about how we see this on our side too, but how patient care is changing and what you're seeing in the clinic, in the exam room today versus maybe what you were seeing 3, 4 years ago, 5 years ago, 10 years ago, and starting in the medical practice. It seems like there are a lot of changes.
I think there have been tremendous changes, and there's been a shift in what the conversation happens as a patient with our doctor and as a doctor practicing medicine today in 2021. Number one, I think, is this idea that it has to shift from being very physician oriented to patient-centric. It is really the experience from the website. I mean, when our moms and dads went to the doctor, there weren't websites for your physician. But today, before you even become a patient, T-minus 1 week, 1 month, 1 year, you can explore what that practice is going to be like for your experience. Yeah. And of course, there's Dr. Google. By the time you found whatever it is you're searching for in medical care, you've already educated yourself, and maybe even to the point where you need your own support team. So there are Facebook groups on someone who might use a surrogate or have a certain medical condition. So you are already surrounding yourself with this medical knowledge. And then when you sit down with a doctor today, it is really about dialogue, informed consent, and talking about, what are my options? In the past, the physician would come in, it was quite more of a dictatorship where you have vaginal bleeding, you've had your kids, you're having a hysterectomy, I'll meet you on Wednesday. It wasn't a dialogue about all the possibilities of care. And then, of course, even like this last 12 months, I think with COVID and us moving to a telehealth conversation, that our video conferencing and Zoom calls with our work are now also with our care providers. So I think there are a lot of really very new things that intersect this conversation of doctor with their patient.
Yeah, and I can say it's so interesting. I think that this trend will continue because we see so many support groups coming online, whether it's on Instagram or Facebook, or where there's obviously an active dialogue. It makes a lot of sense in the context of this being a very personal and very emotional journey where people look for additional support. So I think that this is a trend that's here to stay. And I can say that on the patient side, having been through it, I think that that's right. I mean, there's a lot of positive aspects of feeling that it is a little bit more patient-centric and you're not just being handed a treatment plan. Obviously, I know it comes with obviously some challenges as well. I think it's fair to say, anyone would be very lucky to work with any of the amazing physicians at Bios Fertility, but it's a little bit more of a dialogue or a partnership now. And in the context of part of the solution we're building at Future Family, we believe very much obviously in patient advocacy, in partnership with the clinic, in partnership with doctors. And the idea is that you can talk to a fertility coach. And we would say that we're trying to hybridize this approach. So it's a little bit more reliable and customizable than Dr. Google, because we too see patients who kind of go down that rabbit hole of getting quite concerned. There's a lot of anxiety that also comes from, really binging on blog posts and reading too much. And so I think being able to reach someone who has a trained background in fertility can be an important part of care. But patients are certainly looking for more support than ever. This is a great, Richard, I don't know if you had anything you wanted to touch on here about how.
Well, I would just say, look, I think for us, we're seeing that trend play out across sectors, right? For us, this isn't something that we're seeing uniquely in the fertility space. It's that whenever you have a millennial demographic, that to Angie's point, to Dr. Belsus's point, has Dr. Google in their pocket and has access to, Amazon and Netflix and everything else, the demands that they're going to make of their providers, right, is going to be so much higher than we've ever experienced before. And so you need to be investing in companies. We think about this as VCs all the time. You need to be investing in companies that are sensitive to that and building models around that day one. And when we looked at the fertility space, the reality is that the medical world is often much slower at catching up to those trends than you'll see in other sectors. And so when we looked at other people that might be providing things like finance solutions or benefit solutions, et cetera, in fertility, it's not easy to find someone who appreciates that mindset. And this is a millennial demographic almost exclusively, right? So in other industries, Airbnb isn't just for millennials, right? There's lots of people who benefit from that. Fertility is very predominantly targeting that demographic, and you need to be able to respond to that in your materials, right? In the services and amenities that you're able to provide them. And I think if you can't do that, you can't win in this market.
Yeah, and I agree with you that in the different sectors of medicine, reproductive endocrinology tends to be one that is much more techie and ready for that change. I mean, you brought up earlier the PGT testing, which is where you test an embryo to see if it's healthy. And you can do that just with a random egg and sperm when they come together, looking for things that like miscarriage or Down syndrome. You may have couples that have diseases that could be passed on, and those can also be screened. One of our participants is asking about gene tinkering or gene editing, where maybe that disease could be edited with CRISPR technology. But it is one of those things that we do want to be always mindful of, being moral and legal and ethical, how we use these technologies to help people. Really, what is our purpose? To have a healthy child. So we're going to be, looking as these technologies develop on ways to do that. And as others have asked about embryo selection technology, and these are in the category of PGT.
Yes. Well, that's a good segue in terms of, having healthy babies is really the end goal of so much of the work that all of us in the space do day to day, and perhaps no more so than your team. So maybe we can talk a little bit about the democratization of IVF, access to care. There are changing couples and families getting started all over the world. So maybe we could just touch on that trend. I'm a huge proponent.
Yeah, I mean, truly, your life's work currently is this idea that we want people to be able to have a family, whether they're choosing to do that today or they're trying to preserve their fertility for future use. In the United States, there are areas where insurance may cover fertility coverage. There are other considerations where fertility benefits are available through companies like Kindbody and Progeny that are, allowing states where there may not be insurance. I happen to be in Chicago, Illinois, where we have mandates. And then you have the incredible work of Future Family as an example of brilliant disruption and democratizing the ability to get care. So I think in all different areas, whether it be a couple that's trying to get pregnant with their second child, secondary infertility. It could be egg freezing, people with cancer who need to be able to freeze their eggs, and the LGBTQI, where you have same-sex female needing donor sperm or possibly reciprocal IVF. the same-sex male couples that need an egg donor and a surrogate to help them have their family. And by opening up this market, what we'll see, with this $37 billion market about to be further disrupted.
Yeah, I completely agree with that view. And it's, for everyone out there, there are many different pathways to start your family. There are many different ways that obviously you can be supported. We also often talk a lot, we do a sort of weekly fertility show, and we talk a lot about also the importance of knowing about your options and visiting a fertility doctor early in your journey and getting answers and just being a really well-informed patient. So not just relying on Dr. Google. But this is an important trend about the democratization of IVF and hopefully starting so many more families over the coming years. So let me transition now with our final special guest. So I would like to invite Ashley Binder to the show. And Ashley, if you're there, we're delighted to have you. Hello, hello. Hi, I'm so grateful to have you here today. So in the very early days of building Future Family, the sort of classic startup days where it's like two engineers and a dog, or in my case, a couple of babies, and we're starting the company, we said, we really want to build the solution that we wish we had as patients going through IVF. Like, it was a somewhat lonely and challenging time, certainly for me and my husband. So I don't think that we can in any way, shape, or form provide testimonial whether we've done that or not. But Ashley, you had the chance to be one of our early clients at Future Family. And so I thought it would be great if you wouldn't mind sharing a little bit with the audience today on your journey, what brought you to seek IVF and your background, and then that experience of working with the FF team. I'm sure many people would be curious to know, what is it really like to go through this?
Yeah, absolutely. I'm happy to. And thanks so much for asking me. So I kind of abbreviated version of my story is that my husband and I were trying to have a family for about 6 years. 4.5 of those were with medical treatment. I was in the unexplained infertility bucket. So they didn't really know what was going on. I had some insurance coverage, which I was so lucky and so grateful through my employer to have some coverage for IVF. And we did a few trials, all unsuccessful, some ending in miscarriage, unfortunately, and pregnancy loss. And when we decided that we were going to try one more time, that coverage had run out. And while we make a good living, as you mentioned earlier, fertility treatment is extremely expensive, and we didn't have, $25,000 in addition to what we had already paid to try again. So I found Future Family online, and I was purely at that point looking for just the financial component, rather than doing like a home equity loan or something like that. I had my initial consult and just really found that, Future Family got what I was going through and wanted to help me. The the fertility coach that I ended up working with, Nicole, was just amazing. Since I had been through IVF before, I didn't anticipate that I would really want or need, kind of that extra nurse, because I was already working with one at my clinic. Sorry, pardon me. But it ended up, you can't have too much support when you're going through IVF. It's a full-time job on top of the full-time job you likely already have. That was certainly the case for me. And yeah, the experience with Future Family, not only handled the financial component, but my relationship with Nicole, we still talk sometimes, and my daughter is going to be 2. Like, I can't stress enough how grateful I was for that support. She was rooting for me so much. To have her someone that I trusted who had actually gone through IVF herself was just so wonderful. You know, you touched on this earlier as well, that, you know, you have Dr. Google in your pocket, you have social
Yeah.
media, and that can all get very scary. I mean, I won't lie, like I definitely,
It doesn't
um,
necessarily always apply directly to you. So like one
absolutely, and everyone's experience is so
very
different with
different.
IVF.
Yeah, exactly.
So I could just text Nicole and say, hey, experiencing this thing, what do you think about this? And it was just, yeah, it was just phenomenal.
That's amazing. Well, I mean, the early sort of prototypes of like what we were building and thinking about was, and I'm, think this is very important for what Richard said about where a lot of healthcare is going, and what Dr. Belza said, which is like patient-centric care. We really want to create an experience of using technology, of on-demand support. And that extends when you're a fertility patient, for example, it doesn't stop at 4:30 p.m. when the office closes and your nurse and your doctor no longer answer their phone. It's like a 24-hour experience in some cases. And so this idea that, and it's been accelerated by the COVID tailwinds of like more and more telehealth, that it doesn't have to be a clunky or complex experience. It can be touch points. So on demand, like secure messaging, secure text, video consults, which is a big part of what we do at FF. And we didn't mention this earlier, but it is true that 80% of our care team, our nursing staff at Future Family, have been through IVF. I don't know that will stay the same as we completely scale the company, but it's there's a lot of maybe built-in empathy around what the team does today. But it is something, a single nurse at Future Family today can support up to 70 active patients through a very streamlined digital health platform, and at the same time, I think provide very personalized support that is right there when you need it. So that's something that we think is highly scalable in the healthcare space.
Ashley, thank you very much, firstly, for sharing your story. And as you thought about kind of your options and looking back now at sort of the other ways you could have done this, and probably speaking to people who have gone other routes, like what are the differences that you felt? I mean, clearly having a fertility coach and having someone there that can be a support is a massive sort of plus. But sort of experientially, were there other things that you found in the process, either from a user experience perspective or just from a sort of industry best practices and know-how, that you found that Future Family really kind of helped you?
Yeah, I mean, I would say hands down, it was the fertility coach that made the huge difference for me, and why I've recommended Future Family to friends and colleagues of mine since then. There's, I mentioned earlier, IVF is just such a massive undertaking and a full job. Really, you need to be worried about meds, you need to worry about, all kinds of things. It's a demand on your time, demand on your resources, and having that coach really helps you not only feel supported emotionally, but reminded me like, oh, tonight you have to do your trigger shot, and this is what time you do it, and do you need a quick video lesson on how to do it, or do you remember? Like those kinds of things. To have that available to me at the drop of a hat it really changed the entire experience. Since I had gone through it before, I could say, hands down, the first time was very, very lonely. And I felt after working with Future Family that things were just so much easier. And that says a lot.
One thing that we've noticed in the Future Family platform is, what I think, Ashley, in many ways, what you experience is sort of version 1.0, right? And that, you've touched on some of the complexity that's involved in the process, whether it's sort of drug fulfillment or scheduling and coordination, or just understanding, what's coming out of the genetic testing lab and what you're supposed to do with that information, and having someone on your team that can help you with that. There are actually so many facets of this process that can be tackled. And what you've seen is a very, very positive hands-on experience. I actually now appreciate is really just the tip of the iceberg in terms of what Future Family can do to provide tools for its clients to really, really have sort of complete mastery and complete comfort over all of these areas. And each one of them in and of itself is a minefield, right, to navigate. And I just think that that's going to get better and better, while at its core maintaining, the personal sort of affection and touch and support that you felt, which is at the end of the day, that's core, right? It's core to keeping your customer satisfied and supported through the process. But I think there's a real opportunity for tech to be deployed here as well, to leverage the Nicoles in the system and help give the Ashleys an even better experience. I think that's what we're really excited about as investors. Is it's amazing that we can find plans that allow you to come in and make fertility affordable for you. But if we can then make that experience so much better for you with all these other features, that's how you really win. That's how you grow your customer base, and that's how you keep your customer base. And when you have the tailwinds that you have in the market right now, everything we already discussed on this webinar, whether it be medical related, demographic related, or what have you, that just becomes a very, very potent and powerful mix. So it's probably a wonderful place to pause now and thank Ashley and Dr. Beltzis for joining us on the webinar. Hopefully they'll stick around for a few minutes longer, because we do have some questions that have been popping up through our conversation. I was going to jump into some of those now. I think some of them might have been answered in there directly, but I think some of them would be good just to talk about as a group here as well. So one question that came through was around, do employers use Future Family as a tool or a benefit for their employees? Is that something that you're considering in the growth? And in general, maybe talk about how does Future Family reach more Ashleys and find more people that can benefit from the service?
Yeah, so I mean, a couple of things. We, obviously work in very close partnership with our clinic partners in terms of educating patients. It's important patients have education about financial solutions as well as support solutions as they go through this journey. That's important. I think the employer market, like we're in the early days of seeing how insurance, as Dr. Beltz has mentioned, Illinois, for instance, is a mandated or covered state. Unfortunately, there are not as many of those as perhaps there will be in the long term. But the employers are stepping up to offer some benefits to employees, but that is still in the early days. I certainly think our product and solution can be very attractive to employers as a way to help more and more of their employees afford care. It's not a market we're active in today, but it's certainly a channel that we think is very interesting for the long term. So lots of different ways, and we are, certainly also very active in helping to hopefully build this community, active on obviously social channels. As Dr. Beltz said, so many more people are getting their information through support groups and advocacy. And if you haven't heard the term IVF warrior, it's, there's lots of hashtags you should be checking out in terms of how people are finding and learning about brands and solutions, et cetera. I was going to turn over the floor actually to Dr. Beltzis, but we have a few more minutes of her time because there was a question also about embryo selection technology. And so we talked about the monitoring and understanding the health of the egg, but certainly there is genetic testing of embryos happening today. So maybe Dr. Beltzis, you could share just a little bit about that.
Yeah, I think when we talk about IVF, as most people know on this call, we take the egg and sperm and put them together in the dish to create a little embryo. And at that stage of about 5 to 7 days old, we can remove a few cells from that embryo and test its genetic health, which we call pre-implantation, before it's implanted, genetic testing. And this really opens up, a world of options. But for many couples, they cannot afford that. And I think this is what another incredible way that, Claire, you've been able to help people. And that is this extra cost would be, unattainable for them. So I think this technology will continue to be adopted by more and more people for a variety of reasons to help them get to baby.
Maybe both Dr. Beltzis and Claire can talk a little bit about, the last 12 months have been very, very different, any months that any of us have ever experienced before. And, what did the pandemic do? We talked a little bit about how egg freezing was shaped by it, but what do we think are going to be the long-term impacts as we move out of the pandemic onto this industry here? And how did it handle and navigate itself over the last year?
Yeah.
Dr. Baltus, maybe you want to go first, and then.
Yeah, I would say that in the beginning, about March 17th, almost to the day, the American Society of Reproductive Medicine Task Force said to stop doing any care. In the spring, that got reversed. And what happened is we thought possibly the number of patients interested in fertility testing, egg freezing, IVF would go down, and it has gone up. We have a 31% increase in egg freezers from year to date a couple of months ago. And that's even just gotten more. And we asked why. I mean, some patients who are freezing eggs don't have someone in their life yet. And boy, oh boy, was it hard to date someone, I imagine, in the middle of a pandemic, where how would you meet someone? And if you did meet someone, how would you have the ability to spend time with them? So what happens is a lot of women who are interested in egg freezing may not have a partner, and they also had a little more time since they weren't going to, if they were a kindergarten teacher, they weren't going to class. It was really online. It gave them a lot more room in their schedule. And of course, not as much travel, so a little bit more money that could be directed towards IVF care, fertility preservation. And so what we saw is a dramatic uptake, but not, in patients accessing care. And again, when you have opportunity to help cushion that with future family, I think that really made a big difference.
Great, and I'll just add, reinforce a lot of what Dr. Baltus already shared, which is, yes, we saw that those trends across the country of like increases in egg freezers, which was, positive in terms of, I think, education and women feeling that they have choices today. But also, I think it did start to accelerate adoption of digital technology. Now, some very forward-leaning clinics like Bios have already been on the cutting edge of doing a lot of digital consults, which is amazing because it can reach patients wherever they are, including other countries. So, but not all clinics were as tech savvy, and so we saw more adoption of digital technology, which I think again is very patient-centric. It's very positive. It's how the industry will evolve to offer, of course, digital consults, but other ways to access care. And I think what we're probably facing now, while we certainly saw an increase in egg freezing and so forth, is there is still a lot of pent up demand. We think 2021 is going to be a very busy year because there was a gap in service in Q2 of 2020. And we've had, of course, some folks who understandably were nervous about being pregnant during the height of the pandemic. And so I think you're going to see people very excited to return to getting treatment, and probably now an uptick even later this year in more and more cycles of IVF. So it will be, I think 2021 will be a very busy year for all of us.
Maybe we'll just end on a question around, there's obviously been important political changes afoot in the US over the recent months. And, how did those changes in any way impact, what you're both doing on a day-to-day basis? How do they affect your businesses? And what's the outlook for the future given what's happening in Washington?
I think when we look at a more open idea to IVF and the technologies, I think that that's one aspect, as opposed to possibly a more conservative approach to family building. The idea that the LGBTQI community will be an important element to these numbers, and legalizing marriage in different countries, surrogacy that's allowed more and more, will also have an impact on the financial statements, as well as access to care, and the number of people that will be allowed to do this. So it's a very interesting question that you pose, Richard, and a provocative one, I think, for all of us.
Yeah, and I think that, our role in this is to really stay very connected to both sides of the equation, like working with clinics and working with customers or patients to really understand what are the solutions that are needed to navigate care. I mean, we're continuing to innovate. We have some new products and solutions coming to the market. I think we shared before that in the face of more and more patients asking us, how could they be flexible, especially if they need multiple rounds of IVF? Like, that's a huge area we're very focused on now at Future Family, is how are we helping patients that are going to need multiple rounds, multiple cycles? We've done some innovation work on our friends and family plan. It is now the case that any of your friends and family who want to support your fertility journey can do so through the Future Family platform, and they can help sponsor your plan. So that's one way we're increasing access, but we have some new innovation that we're working on around multi-cycle. So I think it's just a lot about navigating what support and what services do more and more patients need. And as Angie said, there's lots of complexity here around different parts of the journey, whether we're supporting surrogacy, we're supporting couples who are looking at reciprocal IVF, or people who are now increasingly using donor. It's another area I'm very passionate about, is like the possibility is, we talked about egg health, but like donor eggs can be a really great pathway for some couples. So there's a lot that we're trying to bring together for our patients, working with amazing top physicians to help more and more people start their families.
And you bring up one last point, is it is a little bit like baseball. So sometimes you need a few swings at the bat to hit that home run, which will impact the need for more cycles.
Amazing. Great analogy to end on. Thank you very much, Dr. Belzos. Thank you again to Ashley for joining us, and to Claire. And most importantly, to all of you that joined us from around the world to listen to this webinar. Thank you. Thank you for your questions. Thank you for your time. If you had questions that weren't answered by us here or that come to mind afterwards, please do reach out to your OurCrowd investor relations representative, and we will be sure to answer them. If they were in the chat and we didn't get to them yet, we already know that, and we will follow up with you directly. Don't worry. If you want to find out more about Future Family, there's plenty of information on the OurCrowd website, and we can get you the information about VIOS as well. And thank you all for joining. As I hope you all heard and understood tonight, this is an important and growing space, and one that investors are increasingly attracted to, not just in the FinTech solutions, but there's a whole range of interesting ways to play it. We think that combining sort of FinTech with digital health and the way that Future Family does is up there with the most interesting ways to be involved in fertility. I definitely encourage all investors to continue to learn and educate themselves about this space, and hopefully join us as we get deeper into it. So thank you, everybody, again. Have a wonderful, wonderful day, and be safe out there. Bye.
Thank you. Thanks for having me.
For hosting us. Great to see everyone.